Concept of the day, Staphylococcus saprophyticus differential test. Staphylococcus saprophyticus is the second most common cause of urinary tract infections in women aged 13 to 40 years, after Escherichia coli. Staphylococcus saprophyticus is part of the normal vaginal flora. The disruption of the normal vaginal flora with new onset sexual activity increases the risk of cystitis, hence, the late-term honeymoon cystitis. Staphylococcus saprophyticus is catalase-positive, coagulase-negative, and resistant to novobiocin. The latter characteristic helps in differentiating Staphylococcus saprophyticus from Staphylococcus epidermidis. Now question of the day, a 25-year-old woman presents to her primary care clinic for 1 day of dysuria, increased urinary frequency, and a temperature of 38.5 degrees Celsius. She reports being sexually active with a new partner recently. The physical exam is unremarkable. After collecting the appropriate labs, the patient is started on trimethoprim sulfamethoxazole. After 48 hours, urine cultures grow gram-positive bacteria in clusters that are catalase-positive and coagulase-negative. Which characteristic is used to further identify the offending organism? Pause and attempt the question before you continue to view the explanation. Correct answer, E. Explanation. The patient has a urinary tract infection, UTI, caused by Staphylococcus saprophyticus. Staphylococcus saprophyticus is the second most common cause of UTIs in women aged 13 to 40 years, after Escherichia coli. Staphylococcus saprophyticus is part of the normal vaginal flora. The disruption of the normal vaginal flora with new onset sexual activity increases the risk of cystitis, hence, the late-term honeymoon cystitis. The symptoms of dysuria, pyuria, frequency, and fever are the same as in cystitis caused by other bacteria. Staphylococcus saprophyticus is catalase positive, like all staphylococci, and coagulase negative. Staphylococcus saprophyticus can be further differentiated from S. epidermidis by its resistance to novobiocin. You will also find more explanation in the description of the video and also a link to Lecturio for more questions. Do not forget to like, subscribe and click the bell notification button for your daily dose of high-yield concepts. Thank you.